Hello friends, welcome to the ACJ tutorials. Today we will be studying a very important topic, prescriptions. It is a part of pharmacology section. As you can see, I have divided the whiteboard into two sections. One is prescription and second is template. So some of you might be wondering, what is template? So in exam, the NDEB gives you a particular type of format for each and every question. These are the options that you get in case of prescription questions. So I will be discussing each and every option one by one. So let's begin with prescription part first. So in a prescription, as you have already noticed that I have written the name of the doctor, then the address of the doctor. So basically this part belongs to the dentist, date, name of the patient, address of the patient, and this is the part where medicine, frequency, dosage, everything is there. So let's start with first prescription today. So for example, if a patient had acute apical abscess and that patient went to dentist, the patient was prescribed amoxicillin 500 milligram, dispense 15 tablets or capsules, label take 1 TID until finished, repeat or no repeat, and signature of the dentist. So guys, amoxicillin here is the name of the drug. 500 milligram is the strength of the drug. Dispense 15 tablets or capsules. These are the instructions given by the dentist to the pharmacist. That is, that pharmacist has to dispense 15 capsules of amoxicillin 500 milligram. Next is label. Label are the instructions for the patient. So here, take 1. 1 here means dose. That this patient has to take 1 capsule. TID means 3 times. TID here is the frequency. Until finished. Until finished here means duration of therapy. So let's come over it again. Take 1 TID until finished. This means that patient has been instructed to take 1 capsule of amoxicillin 500 milligram 3 times a day until these 15 capsules they get finished. So this means if a patient has been taking 3 capsules per day and the total number of capsules are 15, so the duration of therapy it comes out to be 5 days. Next, repeat and no repeat option. These options are basically meant for opioid drugs. Signature. These are the signature of the dentist along with his or her RCDSO number. The RCDSO number, RCDSO number, is the identification of the dentist. If a dentist is prescribing any opioid drug to the patient, he must write his or her RCDSO number at the end of the prescription. One thing also I would like to add, that if the patient has been prescribed opioid drug, then his ID should also be written in the prescription. For example, if a patient has been prescribed any opioid, then his ID, for example driving license or any other ID, must be written here as well. Let's now discuss the various options that are present in the template of the prescriptions. So I'll first write an example and then we will discuss each option one by one. So friends, the first option is acceptable prescription. We choose acceptable prescription in very few cases only when you have the drug that is given in the prescription is the first choice for the patient. The second requirement for it is the format. That is the way in which the prescription has been given. For example, name of the drug first, then dispense, then label, then repeat, no repeat option, and then signature of the doctor. But if everything is jumbled up, then the format is not right. In that case, we cannot say the prescription is acceptable. Only one exception to this is if the name of the drug is incorrect. For example, in case of amoxicillin, if the dentist had written like this, a pharmacist can still read the name of the drug, but the name of the drug is actually spelled incorrectly. We can ignore these kind of minor incorrect spellings and still the drug is considered acceptable prescription. So we can ignore minor spelling mistakes. So for a drug to be considered acceptable prescription, it must be the first choice of drug for the given indication. Second thing, if there are minor spelling mistakes, we can ignore them. Now the second option is unacceptable prescription format. As I have told you earlier, that if in case of dispense is written here and label is written here, then this is an unacceptable prescription format. Or the other example of unacceptable prescription format is if this sign are not there. Or in case of opioids, no repeat option is not marked. So this means the way the prescription is written, if the structure is not right, then this is considered to be unacceptable prescription format. The third is drug name spelled incorrectly. So guys, as we have discussed in acceptable prescription, the prescription is still considered acceptable if it has minor spelling mistakes, but along with choosing acceptable prescription, you should also choose drug name spelled incorrectly. For example, in this prescription, the name of the drug is spelled incorrectly, but the prescription is acceptable. Then, drug is contraindicated. So, I will give you an example here. For example, if a patient is allergic to penicillin, let's say type 4 allergy to penicillin. In this case, we cannot prescribe amoxicillin to the patient because the patient is already allergic to penicillin. So in this case, drug is contraindicated. Next is life-threatening drug. Life-threatening drug means if we prescribe a particular drug to the patient that can lead to his death or very severe problem, then that drug is considered a life-threatening drug. For example, if a child who has flu-like or influenza-like symptoms and that patient is given aspirin. It can lead to Reye's syndrome, which can lead to severe brain and liver damage of the child. So in this case, the drug will be life-threatening drug. Okay, the next option is drug is not first choice for this indication. As I mentioned earlier, for example, let's take a scenario that the patient had acute apical abscess and the dentist prescribed him clindamycin 300 milligram. So guys, in this case, if in medical history it's not given that patient is allergic to penicillin and dentist had prescribed him clindamycin, this means that amoxicillin was actually the first choice, but the patient was given clindamycin 300 milligram. So in this case, although prescription is fine, but still the option is drug is not first choice for this indication. Then is incorrect strength of pill prescribed. For example, clindamycin, it comes in two strengths, 150 milligram and 300 milligram. But let's say if dentist writes here clindamycin 100 milligram, this type of strength is not available. Actually, this strength I've never heard of. So here you should write incorrect strength of pill prescribed. Then is incorrect number of pills per administration. This is an example to describe what is incorrect number of pills per administration. Friends, here the dentist had instructed that 2 tablets should be taken at one time. This means the patient is taking 1000 milligram dosage of amoxicillin, but the actual dose of the amoxicillin is 1 tablet of 500 milligram. So here, since the dentist has prescribed 2 tablets or capsules, then incorrect number of pills per administration. But let's say if the strength here was 250 milligram instead of 500 milligram, then this was fine, because 250 multiplied by 2 comes out to be 500 milligram. So this means we should always multiply the number of the tablets with the strength of the tablet so as to confirm that whether the number of pills per administration is right or wrong. Next is excessive dosage per day. Let's take another example. So friends, I have written ibuprofen 600 milligram, dispense 20 tablets, and the instructions are take 5 tablets per day until finished. So the next option is excessive dosage per day. I will come to the section where you will learn what is the maximum dosage of a particular drug, what is the frequency of a particular drug, whether it is opioid or it is NSAID or any antibiotic. We will discuss it in coming section. Let's take a look here. 5 tablets of 600 milligram. This means the patient will be taking 600 into 5. It comes out to be 3000 milligram. But the maximum dosage per day for ibuprofen is 2400 milligram. But patient is taking 3000 milligram per day. So if you get a question like this where you are given ibuprofen 600 milligram, 20 tablets, take 5 tablets. So you always have to multiply number of tablets with the strength of the tablet so as to get the maximum daily dosage. Here you are getting 3000 milligram, but according to Canadian guidelines, it should be 2400 milligrams daily maximum for ibuprofen. Since 3000 is more than 2400 milligram, so we have to choose excessive dosage per day. Okay, the next option is incorrect frequency. Guys, if you have noticed here, I had written QID. QID means 4 times per day. But the frequency for amoxicillin is 3 times. That is TID. So here the frequency is wrong. So in such kind of scenario, we have to choose incorrect frequency. Let us now discuss the J and K option, which are excessive duration and insufficient duration. Friends, the normal duration of therapy for any disease or for any infection is around 7 to 10 days. Normal duration. For example, if a patient had acute apical abscess, and dentist prescribes amoxicillin, for only 3 days, then the duration of the therapy is insufficient duration of the therapy. But if the dentist prescribes 5 days or 6 days, then we should not comment on insufficient duration, because this column is very tricky and risky. So in my suggestion, if you get 5 days or from 5 to 10 days, don't comment on insufficient duration or excessive duration. So basically 5 to 10 days is normal. A general view about this is, if you have any chronic infection, then 7 to 10 days are good. If you have acute infection, then 5 or more days are good. Okay. Then the next option is excessive duration. Excessive duration means if the dentist is prescribing medicine for, let's say, 13 days or 15 days, this is excessive duration. So basically, don't comment if you are given the duration between 5 to 10 days. Don't comment on duration. But if the duration is less than 5, let's say 3, this is insufficient. If duration is more than 10, let's say 13, this is excessive duration. Now let's move on to another option, which is repeat or no repeat selection is incorrect. This option is only applicable to opioids. Let's say meperidine. The patient was allergic to natural opioids, so the dentist prescribed meperidine to the patient, but he forgot to mention no repeat. In that kind of scenario, you have to choose repeat. No repeat selection is incorrect, because for an opioid to prescribe, then no repeat should definitely be chosen here. Friends, incorrect or ambiguous instruction means if the dentist is giving some weird instructions to the patient, and these instructions refer to dose, frequency, route of administration, and duration of therapy. So if any one out of these things, that is dose, frequency, route of administration and duration of therapy is wrong, then you have to mark these things according to this, but along with these options you have to choose this one as well. So the example is ibuprofen 400 milligram. Here ibuprofen is right. 400 milligram is also right, as ibuprofen comes in 200, 300, 400 and 600 milligram of strengths. Dispense 20 tablets, it's also right. Instructions to the patient: take one. The patient has to take one tablet of ibuprofen IV. It is tablet, it's not a solution, so the route of administration is wrong. QID is the frequency. Frequency is right. PRN means as and when required basis. So basically here, since the route of administration is wrong, so out of these options we will choose incorrect or ambiguous instructions. Let's take another example. So friends, I have made some changes in the instruction part. Ibuprofen 400 milligram, 20 tablets, take one orally. So now the route of administration is right. QID, frequency is also right. For 3 days, always remember, in case of analgesics, there is no strict regimen for the drug. So basically, in case of analgesics, the only fixed things are strength and frequency. But if the dentist says you have to take it for 3 days or 5 days for any analgesic, be it opioids or any NSAID, then this is wrong. For an analgesic, it should always be written PRN. If this PRN is not written, then we have to choose incorrect or ambiguous instructions. Let's say the dentist writes here until finished. So some of you might be wondering, okay, what should we choose now, because now the duration is not written. No guys, as I have told you earlier, QID means 4 times. So this means the patient is taking one tablet 4 times, that is 4 tablets per day. Total number of tablets are 20. So until finished means 20 divided by 4, it comes out to be 5 days. Here also the regimen is very strict, which is not right in case of analgesics. So here again we will choose incorrect ambiguous instructions. So in case of NSAIDs or opioids, always PRN should be there, otherwise it will be incorrect or ambiguous instructions.